Approved uses. Botox Cosmetic, onabotulinum toxin A, is a prescription medicine that is injected into muscles and used to temporarily improve the look of both moderate to severe crow's feet lines and frown lines between the eyebrows in adults. Important safety information. Botox Cosmetic may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks, after injection of Botox Cosmetic. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms, including loss of strength and all-over muscle weakness, double vision, blurred vision, and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. Botox Cosmetic dosing units are not the same as or comparable to any other botulinum toxin product. There has not been a confirmed serious case of spread of toxin effect when Botox Cosmetic has been used at the recommended dose to treat frown lines, crow's feet lines, or both at the same time. Botox Cosmetic may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox Cosmetic. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you are wheezing or have asthma symptoms, or if you become dizzy or faint. Do not take Botox Cosmetic if you are allergic to any of the ingredients in Botox Cosmetic. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myoblock, Rimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Xeomin, Incobotulinum toxin A. Have a skin infection at the planned injection site. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox Cosmetic. Tell your doctor about all your medical conditions, including plans to have surgery, had surgery on your face, weakness of forehead muscles, trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox Cosmetic can harm your unborn baby. Are breastfeeding or plan to. It is not known if Botox Cosmetic passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox Cosmetic with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox Cosmetic in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myoblock, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received. Have recently received an antibiotic by injection. Take muscle relaxants. Take an allergy or cold medicine. Take a sleep medicine. Take aspirin-like products or blood thinners. Other side effects of Botox Cosmetic include discomfort or pain at the injection site, headache and eye problems, double vision, blurred vision, drooping eyelids, and swelling of your eyelids. For more information, refer to the medication guide or talk with your doctor. To report a side effect, please call Allergan at 1-800-433-8871. Please see Botox Cosmetic full product information, including boxed warning and medication guide, on BotoxCosmetic.com.
Juverderm XC, Juverderm Ultra XC, and Juverderm Voluma XC. Important safety information. Approved uses. Juverderm XC injectable gel is for injection into the facial tissue for the correction of moderate to severe facial wrinkles and folds, such as nasolabial folds. Juverderm Ultra XC is for injection into the lips and perioral area for lip augmentation in adults over 21. Juverderm Voluma XC injectable gel is for deep injection in the cheek area to correct age-related volume loss in adults over 21. Important safety information. Are there any reasons why I should not receive any Juverderm injectable gel formulation? Do not use these products if you have a history of multiple severe allergies or severe allergic reactions, anaphylaxis, or if you are allergic to lidocaine or the gram-positive bacterial proteins used in these products. What precautions should my doctor advise me about? Tell your doctor if you are pregnant or breastfeeding. The safety of these products for use during pregnancy or while breastfeeding has not been studied. The safety of Juverderm XC and Juverderm Ultra XC injectable gels in patients under 18 years and the safety of Juverderm Voluma XC in patients under 35 years or over 65 years has not been studied. The safety and effectiveness of Juverderm XC for areas other than facial wrinkles and folds and Juverderm Ultra XC for areas other than the lips and perioral area for lip augmentation or facial wrinkles and folds have not been established in clinical studies. The safety and effectiveness of Juverderm Voluma XC in areas other than the cheek area have not been established in clinical studies. Tell your doctor if you have a history of excessive scarring, e.g., hypertrophic scarring and keloid formations or pigmentation disorders, as use of these products may result in additional scars or changes in pigmentation. Tell your doctor if you are planning other laser treatments or a chemical peel, as there is a possible risk of inflammation at the treatment site if these procedures are performed after treatment. Patients who experience skin injury near the site of injection with these products may be at higher risk for side effects. Tell your doctor if you are on immunosuppressive therapy used to decrease the body's immune response, as use of these products may result in an increased risk of infection. Tell your doctor if you are using medications that can prolong bleeding, such as aspirin, ibuprofen, or other blood thinners, as this may result in increased bruising or bleeding at the injection site. Minimize strenuous exercise, exposure to extensive sun or heat, and alcoholic beverages within the first 24 hours following treatment. What are possible side effects? The most common side effects include tenderness, swelling, firmness, lumps, bumps, bruising, pain, redness, discoloration, and itching. With Juverderm XC and Juverderm Ultra XC injectable gels, most side effects are mild or moderate and last 14 days or less. For Juverderm Voluma XC, side effects are moderate, uncomfortable, and last 2 to 4 weeks. One of the risks with using this product is unintentional injection into a blood vessel, and while rare, the complications can be serious and may be permanent. These complications, which have been reported for facial injections, can include vision abnormalities, blindness, stroke, temporary scabs, or permanent scarring. As with all skin injection procedures, there is a risk of infection. To report a side effect with Juverderm XC, Juverderm Ultra XC, or Juverderm Voluma XC, please call Allergan Product Surveillance at 1-800-624-4261. For more information, please see juverderm.com or call Allergan Medical Information at 1-800-433-8871. Available by prescription only. Latisse Bimatoprost Ophthalmic Solution 0.03%. Important information. Approved use. Latisse is an FDA-approved treatment to grow eyelashes for people with inadequate or not enough lashes. Important safety information. If you use or used prescription products for eye pressure problems, use Latisse under doctor care. May cause brown darkening of the colored part of the eye, which is likely permanent. Latisse may cause eyelid skin darkening, which may be reversible. Only apply at base of upper lashes. Do not apply to lower lid. Hair may grow outside the treatment area. If you have eye problems, surgery, consult your doctor. Common side effects include itchy and red eyes. If discontinued, lashes gradually return to previous appearance. To report a side effect, please call Allergan at 1-800 433-8871. Please see Latisse full product information.
Important safety information about Kybella. Kybella is a prescription medicine used in adults to improve the appearance and profile of moderate to severe fat below the chin, submental fat, also called double chin. It is not known if Kybella is safe and effective for use outside of the submental area or in patients under the age of 18. You should not receive Kybella if you have an infection in the treatment area. Before receiving Kybella, tell your healthcare provider about all of your medical conditions, including if you have had or plan to have surgery on your face, neck, or chin, have had cosmetic treatments on your face, neck, or chin, have had or have medical conditions in or near the neck area, have had or have trouble swallowing, have bleeding problems, are pregnant or plan to become pregnant, it is not known if Kybella will harm your unborn baby, are breastfeeding or plan to breastfeed, it is not known if Kybella passes into your breast milk, talk to your healthcare provider about the best way to feed your baby if you receive Kybella. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take a medicine that prevents the clotting of your blood, antiplatelet or anticoagulant medicine. Kybella can cause serious side effects, including nerve injury in the jaw, which can cause an uneven smile or facial muscle weakness, and trouble swallowing. The most common side effects of Kybella include swelling, bruising, pain, numbness, redness, and areas of hardness in the treatment area. These are not all of the possible side effects of Kybella. Talk to your healthcare provider for medical advice about side effects. For more information, please talk to your healthcare provider or see full prescribing information in our brochure or on our website at www.mykybella.com.